Welcome to the Electra-Med Edge, where we explore the science, technology, and innovations advancing human performance and patient care through precision measurement. I'm Andy, Clinical Sales Manager at Electra-Med, and I'm excited to have you join us as we launch this new series. Electra-Med is proud to be a service-disabled, veteran-owned small business founded in 1975 as a biomedical service organization. Nearly 5 decades later, our mission remains the same: to deliver not only cutting-edge equipment and supplies, but also the support of the sale, meaning we're here for our customers long after installation and training. Today, Electra-Med provides full-service solutions across neurology, cardiology, physical medicine and rehabilitation, sleep diagnostics, respiratory care, and U.S. government contracts, serving clinicians, researchers, academics, and performance professionals nationwide. Through Electra-Med Edge, we'll bring you conversations with experts, insights into emerging technologies, and real-world applications from across these fields, all aimed at advancing human performance and clinical precision. Let's get started. Hey folks, welcome to the Electra-Med Edge. I'm your host, Andy, Clinical Sales Manager for Electra-Med Corporation based in Flint, Michigan. We are the premier sales and service for a wide variety of physical medicine, neurology, cardiology, sleep diagnostics, and respiratory care. On today's episode, we have Mr. Brian Williams, Senior Lecturer, Internship Coordinator, Director of Human Performance Lab, Master's Degree, Certified ACSM Exercise Physiologist, and Certified Health Coaching through the American Council of Exercise. Mr. Williams is the primary responsibilities of teaching undergraduate courses in exercise physiology, exercise psychology, exercise testing and prescription, EKG, and professional development at Valdosta State. Mr. Williams, thank you so much for joining us today. How are you?
Good. Thanks for having me.
Oh, you're very welcome. Thanks for coming on and being part of the Electra-Med Edge. So today, if you wouldn't mind giving our listeners just a little bit more background about yourself, can you help explain your role within Valdosta State, please?
I teach full-time as a lecturer in the exercise physiology program in the School of Health Sciences. I also kind of run our teaching lab. So we have a exercise physiology laboratory that we probably use it for instructional reasons, but in the past it has been used for research. I served as our internship coordinator for the undergraduate degree program. We also have a I guess you could call it like an adult fitness program that our department runs. We call it the Center for Exercise Medicine and Rehabilitation. It was originally developed to have our exercise science students, and when we had an athletic training program, those students to kind of get some, clinical kind of experience. And it's kind of evolved from there or changed some since we started it back in 2015, I want to say, 2015, 2017. But we still, run that. We have people in the community, people from campus who come to use that facility, and it's various adult populations that use that facility, different health issues, etc. But I was previously more involved as an EP down there. When I was originally hired, I was kind of partially down there working as an EP and then also instructing. But then as time changed, my role became more just faculty. So I'm less involved with the SEMR. That's what we call it, is the SEMR. I just really kind of help place students down there for internship. But that's kind of the overall synopsis of my role here at Valdosta State.
Awesome. Excellent. Well, thanks for sharing that. It gives our listeners a little bit more background of the folks we engage with. So thanks. So, get into, you mentioned a lot of student engagement, especially in SEMR, if I said that correctly, was, one thing as being both the lecturer on the teaching, exercise testing, prescription side, Yeah, what are some of the most important skill sets or skills that students need to bring with them while they're either entering the exercise science field, or maybe they've just completed their coursework and now they're going out as early professionals?
Well, definitely familiarity with equipment, especially like exercise related. I will say, like, in most of the classes that I teach, yes, that equipment's more testing focused, or even like things like use of a glucometer, of course, blood pressure cuffs. And we teach our students auscultation mostly, but I do have some automated machines, one that's more specific to resting measurements, one machine that can be used with stress testing. But yeah, like equipment, definitely being familiar. I don't teach our strength and conditioning courses, but I know I could speak for like with those classes. Yeah, like familiarity with equipment that can be used when it comes to training too. So, it's sometimes just because of the time and what we have access to, and maybe even the students' interest themselves. Like, sometimes they don't get that familiarity until like they go and do internship, with some of those things. So we try to expose them as much as possible to a variety of modalities when it comes to equipment that can be like testing specific or like can be used as part of training. And then besides like exposure to use of equipment, technology, understanding how to interpret the information, the data that's collected. Sure. And then another thing is to communicate. And that sometimes is hard depending on the class and what's going on. And, as a professor, you have to crowd control often. And sometimes the communication part gets kind of neglected. But I try to remind myself about, oh yeah, don't forget, Brian, tell the students about, okay, besides interpreting the information, how are you going to communicate that to your patient, to your exercise participants? Because you want to make sure that they understand what that data means, because they're going to be like, okay, you gave me these numbers. What does this mean? Because sometimes like students, especially early on, they don't get that who they're speaking to doesn't understand what they're saying.
Sure.
That elderly person or person who has not been very physically active or not familiar with exercise, like they're not going to know what all those measurements mean exactly. So yeah, interpretation, communication of that data, also like general communication, that's like those soft skills, that too, like, it's hard to simulate at times in class, like to get the students to communicate. Yes, they could take like a public speaking class, but like sometimes like you want to do things within the major, within your courses. And so sometimes because of the nature of what's going on with class, like we don't always have that time or can effectively simulate things. But yeah, definitely like active listening, the reflecting back of what a participant says, are important skills that students need to acquire. Even like motivational strategies. So like going into like kind of exercise psychology, understanding some of the theory models of behavior change and the strategies that correspond. Those things can be used to help people when it comes to motivation. And then even like coaching ability. In exercise psych, our instructor who's been teaching our strength and conditioning course for athletic performance, he's real big with like coaching. It's like, hey, look, guys, you gotta do these things that are ideal when it comes to coaching your participant to get them to push through, to do things relating to training and performance. So those all are like exposure to the equipment, understanding the data that's collected, and then like the whole motivation part, error, and how you can motivate people or coach people, I think are all important skills that those going through an exercise science program should try to acquire.
Absolutely. So yeah, I really agree with you because if you're working with an individual, right, it's your SEMR, well, you keep using that as a kind of a reference point for us. But you ask somebody, hey, I need you to work out at a 7 RPE. Well, what is a 7 RPE? That's just a number with 3 letters behind it. But being able to translate, our ratings of perceived exertion, or being able to actually like quantify like MET activity, MET levels to activity somebody's familiar with, right? So us being up here in the north, we're shoveling snow, so we're up that 18, 20 METs potentially,
Right.
versus somebody who's a little bit more sedentary. You're sitting there at 1 MET. But I think you really bring a good point as to how students start to get those concepts that start to quote click for them, and how they can translate that into the general population. So, which is and it's really good that you brought that up, and that kind of leads me to my next kind of thought question here is, why do you think it's so important for students, even professionals, to learn these objective, exercise testing measures, but then also integrate that motivational interviewing, or those motivational interviewing techniques you just mentioned as well?
Yeah. Say the question again, the first part.
Sure. So bringing into your, like, why is it important for students and professionals to learn, objective exercise testing methods, but then also merging or integrating them into the motivational interviewing techniques and behavior change as well?
Um, 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 think how this might come off. Um, I guess to better like understand how to develop um, individualized like treatment and training plans. Like you want to objective measures, can better definitively, and sometimes it's not always, absolute. Like it's still pretty it can still be pretty relative, but it can better help with developing training or treatment plans that can meet the needs, meet the goals of the participant. You don't always want to like go off of like estimation or subjectivity, because you might under or over do things with the individual to where it's like, you might pose like a safety issue, increase the risk of injury. And then as far as like setting a program where they're underperforming, well, they're not going to meet, what their goal might be.
Sure. And I think you're spot on. And the first behavior change model that comes to mind initially is the trans theoretical model.
Oh yeah, that's our favorite.
Right? But I think that model actually lends itself to working through the kind of the overall spectrum with folks, right? They start at one point, and you're going to have those ebbs and flows. You're going to have successes. You're going to have setbacks. But for students to, whether they use it on a daily basis or whether they're just working maybe with a one-on-one personal training client, having that model in the back of their mind is really an important aspect to coaching someone to their end goal.
Yeah, and strategy changes too, where like early on, yes, you give them those objective measures and you kind of tell the person, okay, this is where you're at as far as physical fitness level. And if they are completely sedentary or they might be active, they're just not doing what's optimal yet, you can explain to them, hey, look, this is what's optimal according to American Heart Association, ACSM, etc. And this is why. And that's where you can go into like the risks, like comorbidities, all that stuff. And then, you're providing them with that information. That's what's called conscientious raising.
Sure.
And there's other things like where you have the person kind of reflect on themselves, how are they setting the example for others? Them ask them to reflect on the past, like were you active more in the past? What were things that changed? What are things that kind of came up? And yeah, like as a person progresses through the stages of change, that's where like, you can inquire about like, okay, what will it take to get you to commit, go through like, some preparation strategies to get the person into action. And then once they're in action, it can be more focused on more of the behavioral strategies where it's, um, um, social support, them doing more like scheduling, setting cues, prompts. That's what I also like to talk to students about use of like technology. So like I have a smartwatch. I was just looking at my Chorus. I was getting an email. Like I could silence my phone, but then my watch is connected to my phone via Bluetooth. But yeah, like if I like yesterday, for example, I was working on something very diligently and my watch indication about, hey, look, you've been sitting for a while. Won't you get up and go move around? So I use this wearable to not only prompt me, so that's stimulus control, but prompt me to go be more active. So I talk to students about like how technology, like smartwatches, for example, can be effective tools to help get people to be active. But I also use this, like I'm a very avid runner, and this records metrics that I find helpful to show me where I'm at as far as my current training plan and my progression. So, and it gives me more than just heart rate data. And there's different metrics I like to look at, like my running efficiency, my cadence, okay, the route I took, what was the elevation like, the gain change, etc.
Oh, yeah.
And so a lot of that kind of gives me an idea, okay, how did things go as far as my run? And so that kind of stuff can be very helpful once a person, gets into action, and then even like, and I'm visualizing my Chorus app that I use that shows me all these numbers, but yeah, like I've been very active for a while now to where like I can look at, okay, how has my base fitness and all been or my trend with my training been for the past 90 days, 6 months, 1 year. Like how do I compare like up or down since the same time last year? So like those are things like, especially once a person gets into maintenance, that like they can kind of see, okay, how are they as far as maintaining their current training status? Are they trending down? Are they kind of level, or are they trending kind of up?
Sure. Right.
So, and that even can be like integrated with things that like, for example, like a strength coach might want to know, if they're doing a particular periodization kind of program with their athletes, yeah, they might want to collect data to kind of see, okay, where are their athlete currently based off of that block or cycle that they're putting their athlete through. Like, are they showing any signs of, improvement, or is there some fatigue happening and they're kind of starting showing signs of like overtraining maybe?
Sure.
So,
and we know a lot, or we know a lot more, I should say, now about overtraining may not happen immediately, right? But you may succumb to overtraining 2 or 3 weeks later down the road than what you actually think. And that's where I think the wearable technology is really starting to make a big push. But, you bring up some really good points about like working with students who, they're coming up in a completely different tech age and wearables.
definitely.
You and I even, I feel like what I shouldn't say antiquated, but what we learned is we're playing catch up to their tech, right? And
Exactly.
so, but I guess my question next is around this mindset is how do you help students understand the difference between measurement precision, so i.e. being like in a lab in a sterile environment where you can control a lot of factors, whether it be environmental or just speed, pace, everything like that, but apply that to real world applications where yeah, I think even older adults now are more keen into their health and their fitness. So even if they're wearing like a smartwatch or, other wearables, I guess I'll repeat the question, but how do you help students understand the difference between measurement precision and real world application?
I can think of multiple different things that can come up. Yeah, like there's so many variables that can happen in the real world that are difficult to control for. And sometimes, the equipment we have in a lab setting just is not applicable or always reliable when something is it's like a stress environment. There's a rush for time. Yeah. And, you hear that expression of like, is it good enough for science? Sometimes I use that with students where like, say if they're uncertain whether like they took that blood pressure measurement right, like say if it's a practical, where I'm like listening with them, they're like, I'm not too sure about this blood pressure. I was like, what did you get? All right, this is what I got. All right. You're not far from what I heard, so it's good enough for science,
Sure. Yeah.
And now it might depend on the situation, though.
Of course.
If you're talking about something that's like emergency medicine related, then it's like, no, you want things to be pretty precise.
Yeah.
But yeah, it can be tricky at times that sometimes with the real world, time that's needed to take the measurement, the stress, like it just isn't going to work. And there's even like environmental factors. Like I remember a professor, a friend of mine who did like a study with like measurement of core temperature.
Oh,
And he used the device where it's like you ingest the capsule and you just kind of wave the wand
yeah.
belly. Well, looked great in the lab for him. However, he did a environmental physiology study where he was looking at core temperature of fishermen when they were out to sea, and the device would not work accurately.
Nope.
It is because of I guess the environmental changes, the pressure or whatever out the water affected the device. And so yeah, like you have sometimes settings, situations like that where it's like what's done in the lab, it's difficult to replicate in the real world setting. But what I try to tell the students is like being familiar as best as possible with taking measurements, practice, and trying to become as proficient as you can with doing measurements. That way, like when you are in the real world setting where it's like there's kind of a rush to do things, like you can be as precise as possible.
Sure.
So, but yeah, like having technology that's a little bit more accurate in measurement. Like I hear this a lot, especially like with wearables, like your wrist worn watches. Like I've had colleagues who've worked in cardiac rehab who've had patients, that have a pacemaker, ICD, and they're relying on, when they're not in the clinic, they're relying on their Fitbit, right, tell them where the heart rate's at. Well, if you have an ICD, you need to have a precise measurement of your heart rate because you don't want that device to activate and you hit the ground. So yeah, those friends of mine that have worked in those rehab settings have said it's like, yeah, to remind the patients like, hey, look, always rely on that device. Like, just be like, go off of feeling, just know, okay, maybe you should back down, like self-regulate, I guess is what they try to tell them, to kind of back off their pace. But yeah, like being as familiar as possible, getting your reps in with use of equipment. And that's hard, especially in the class setting, because there's a rush for class time. And then we have so much time in the semester. There's different things we're trying to cover. And sometimes like the students aren't going to, in that one class period or that one class in the semester, they may not come as proficient as possible with using certain equipment. And that's why like I try to tell them, hey, look, you need to get in your practice time, and also maybe find the right experiences. Like if you really do want to work, say like in the cardiac rehab, like no one's stopping you to go and maybe go, like we literally have a hospital across the street from us. And that hospital is one of our sites where we have students intern in cardiac rehab. And so it's like, look, if you want to get more reps in with taking blood pressure and you want to do it on like actual patients, like y'all can sign up to be to volunteer to shadow at SGMC, and I'm in contact with the care coordinator with cardiac rehab, and she can get you in to like, volunteer, observe. I'm sure she will allow, because you'll be supervised, to like practice taking blood pressures on those patients. And then once the students progress to internship, so in our program, all the students do an internship, and it's a full-time internship, and they do that in their last semester. It's what kind of capstones their degree. And really it's technically an externship. We just call it an internship. But yeah, like that is a good time where it's like, hey, look, you have the time to hone in and practice on those skills, or use that equipment more thoroughly.
Right. Absolutely. No, and that's where the real world and comes into play, because even though those health centers, they may have a little slightly different way of doing it. They may have some slight different technology or equipment that is ultimately going to make those students well-rounded on the.
Yeah. And two, I think that exposure to a variety to like, for example, like we have a body comp lab, and we have a DEXA, we have a bod pod, we have a Tanita, BIA machine, and of course we teach our students Skimfold. And like I have them do a lab where basically they do all those body comp assessments, and they can compare their participants' numbers. And of course there's usually a range. There's not any consistency. And I try to tell them, hey, look, the DEX is probably going to be the gold standard. Not to say that the DEXA is like 100% accurate. I'm sure there are times where it's like the number might be not exactly what's true, but I try to tell students like, hey, look, this is what we call the gold standard. So how does your other numbers compare to that one?
Sure.
And of course there always is some variety. And sometimes like the difference isn't much, but sometimes it is, like
right.
if that Skimfold or BIA measurement is like 10% off from what the DEXA measured, then it's like, okay, that says something about how proficient you are with your Skimfold measuring, maybe.
Right. And that technique is a perishable skill and hard to master at the same time, right? Because there's, as you know, a lot of factors that go into Skimfold's hydration status, user experience, tester experience, everything like that. But
yeah, well, and even BIA, like what we have, it's not the most expensive, but it is a decent BIA. But I try to tell the students, like, don't go to said place. Like, I'm not going to name any places specifically, but don't just go buy the $30-$40 BIA machine that's handheld and think that that's just as accurate as the one we have that is thousands of dollars. What is going to be the more expensive piece of equipment probably is going to have the better technology, and it probably is going to be able to take a better measurement.
Sure.
But yeah, there's those other variables like hydration status and whatnot that can affect accuracy of the measurement. So yeah, like being familiar with what are those factors that can affect the test, retest, reliability, the validity is important to teach the students. And we try to get them to understand. It all depends on like was going on in their life at that time. They started really paying attention.
Absolutely. No, I hear you. I hear you. But no, that's good. And you're bringing a well-rounded approach to exercise psychology, to behavior change. And I really think this is an interesting gap or a gap that needs to be filled because, a lot of times I think working with exercise science, exercise physiology students, they're so locked into the importance of exercise, understanding what's going on and learning all these skill sets. But how would you help explain the way to better bridge that gap between exercise psychology, exercise physiology, knowledge, and human behavior?
Yo, 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 yo. Let me think about that. Yo, 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 yo. Bridge the gap between exercise physiology, human behavior.
Yeah.
I guess what I can think of is, okay, so like, students the same semester that they take the exercise physiology course, they also take exercise psychology, and typically, depending on the semester, they either take they take the two classes back to back.
Okay.
So, it's either, Ex Phys, then exercise psychology, or the other way around. And so I try to tell the students, like, hey, look, think differently when it comes to learning physiology versus the psychology, because physiology, it's probably like a little bit more black-white when the psychology is gray. There may be some subjectivity, and it's more, thought oriented, more trying to think of the word, pure,
Okay.
And so spending time studying the exercise psychology literature, trying to connect it with, okay, what's going on as far as like physiology. I even tell the students, like when I teach that exercise psych class, which I'm teaching it right now, this semester, maybe relate, some of the theory and all that I talk about to, like, sports or personal experiences, so they could better kind of conceptualize things. Sometimes I even give my own, like, experience,
Sure.
like, when I talk about overtraining and burnout. I talk about my time when I was in college. I was a collegiate cross country runner, and I went through burnout as a sophomore, and I explained to him, like, physiologically, this is what I was showing, and then performance-wise, this was what was happening. And then too, like, from a psychological standpoint, like, I was experiencing, some chronic stress, probably some depression. I was really, like, I felt like I had that loss of identity. Like, those are all, like, typical symptoms of someone going through burnout, especially relating to training and athletic performance.
Right.
So yeah, like, giving my own, like, kind of testimony, I guess you could say, or getting students to kind of reflect on how they can apply the theory and models that I talk about in class to, some of the physiological, some of the personal experiences with exercise training. I try to help them with trying to bridge that gap that you're talking about.
Sure. Absolutely. No, it's great. That really is. So, yeah, as we kind of start to land here a little bit, just a few more talking points is what advice, or actually, let me rephrase this, like, what are maybe some technology shaping, or how do you see technology shaping the way we educate our future clinicians and performance specialists? So kind of going back into what we were mentioning earlier about, the wearables, and admittedly, you and I are probably behind on the tech curve a little bit, even though I feel like we're somewhat proficient. But yeah, again, how do you see technology shaping how educators are going to better prepare the future clinicians and performance specialists?
Yeah, like definitely like the one thing that comes to mind first is like besides like wearables, is like you know, becoming more familiar with equipment that's more user friendly, maybe more integrative as well. It's like, why do we have all these toys connected to the person when we can kind of like consolidate things? It's like that's what I like about my setup for class this morning. I had the students do some mock stress testing, and and it's not the fanciest. It's probably a nice stress testing system that I have, but it's probably not the fanciest. But what I like about it is like I have an automated blood pressure machine. And of course, you have the EKG. I have a pulse ox. It's all integrated in that one system, and instead of it all being separate devices. And then I also like that, hey, look, I can program things to where like the treadmill is run by the computer. It's automated.
Yeah.
You don't have to have another person doing all the controls for incline and speed. So more compact, more user-friendly devices. I hope that's where we're going with technology. Probably some AI integration there. Every time I think of AI, I think of Terminator for some reason. I had like an ongoing kind of thing with some colleagues where it's like whenever someone brings up about AI and whatnot, like especially like with students using things, I always send a GIF of not like Arnold Schwarzenegger Terminator, but one of like the robots that don't have like any of the skin on, and they're just kind of like turning their head. But yeah, like I see like even myself, like it hadn't been until recently that I've started to use some AI programs. And not for any like scholarship. It's more of like, okay, help me with just coming up with some ideas.
Sure.
So it's like something that I want to, brainstorm basically.
Right.
So like I get on my Copilot app, and I've used ChatGPT a little bit, but I mostly use them to help me brainstorm some ideas, to come up with some things relating to maybe assignments or how I want to like make a presentation on a particular topic. I've even used it to like help me brainstorm for like some stuff relating with like what I might want to post on Instagram. So like I help manage our Instagram page for our program. So I've been trying to do that more now. But yeah, like telling the AI to as far as running a particular program. I've been here. I haven't played with this, but like I've heard about like use of the AI to create like training programs and all.
Yeah.
I've even heard of the programs where like clinicians might use to kind of like with dictation,
Sure.
coming up with a document or notes on the patient. So some of that I can see trending. Like if you asked me about AI stuff like even 5 years ago, I'd be like, we're not going to do that. And then just within this short time frame, you're starting to see it more and more.
Oh yeah.
So
yeah, almost overnight it feels like. So, but it's here to stay. I think there is a place, especially in the exercise science realm and world, of whether it be from creating ideas or maybe being able to use it as a teaching tool for even students to kind of help better run scenarios of how to deal with patients that they've maybe never worked with before. But I think it's definitely going to be a neat thing. So with that being said, the kind of last talking point here is, what advice would you give to students who really do want to make a truly lasting impact in exercise science, into our field, but also to further the science, as you will, right? So to make it better than good for science, right?
Yeah. Well, I would definitely say, just because I'm a big proponent of experiential learning, is to seek out opportunities. To just wait for opportunities to come your way. Just because you spend all this time and monies and whatnot earning a degree, don't think that like, oh, you're guaranteed to get a job, especially related to a certain area you want to work in. So like, seek out opportunities, maybe like if you're in a rural, I will say like where our university is at, it's in a rural area of South Georgia. And so very often, like, yeah, people have to move away to go get a particular job. Not all industries are well represented down here. And so, yeah, sometimes you have to like seek out those opportunities to be able to do what you want to do. That was my experience, and as well as my wife's. Like both of us are originally from different parts of Louisiana, and so yeah, we literally moved multiple states away to do what we're doing. So yeah, like seek out opportunities, don't wait for them. While in school, go do some observations, go volunteer, even if it's like not a setting directly related to what you think you might want to do. Like if you're not necessarily interested in research, but you're like, hey, that looks cool, or hey, I like that professor. It's like, well, go ahead, be a student assistant, you know? Not so much when I was an undergrad. It was more when I was a master's student. That's what I did. My first semester or two was like, I more volunteer assist because I wanted to get some exposure to doing research. And initially, that what I was helping with, I really wasn't interested in necessarily to do myself. Like what I did as like a thesis project was more psychology oriented, and I was doing like, where I was helping with like prepping blood,
Yeah. Okay.
putting through centrifuges and all,
Sure.
because that particular professor was doing was more endocrine related.
Okay.
But I just wanted to get that experience
Sure.
just doing research. So
Learn how to pipette, probably plasma and whole blood and everything, and the white Buffy coat layer in between, and everything.
yeah, and how to properly invert a tube. And I say that because there was one time where I spilled a whole vial of blood. Luckily, I was wearing a white coat. It did not look well. And what was funny was we had a nurse at the time who was taking the blood out for us. Yeah, that particular professor was very particular. Like, he's like, no, I'm not gonna have y'all do phlebotomy training. We have a school of nursing. I can get a nurse here to get the blood for us. He was that particular. But yeah, whenever I did that, the lady looked at me. She goes, well, I guess I'm gonna be pulling some more blood. So she didn't make a big deal about it. She's like, all right, well, we had like an arm catheter in the person, and she just like pulled for more blood.
Yeah,
but
good.
But yeah, like volunteering, doing extra things, and then yeah, like if in a program you're in, there is like a internship, externship, clinical kind of rotation. Maybe seek out doing those experiences or doing that experience in a setting that you're very interested in, or will challenge you. Like I have a number of students who, they did not want to stay locally for internship. They're like, no, I want to do something that just me, that more relates to what I want to do. Like I could think of one student off the top of my head who he literally went across the country. He went all the way to like Arizona. Oh wow. To do his internship because he really wanted to do something that was sport performance related, and he wanted to work with soccer players because his ideal future career was to be that performance coach who works at a soccer academy. And that's what he does now. Like he got an internship in a setting like that, and he got hired on pretty much right after internship. And so like he's been there ever since.
Okay.
So like that kind of a thing I think would be great. It's not always going to happen. And that's another thing too, is like, comes to plan doesn't always come to plan, but it doesn't necessarily mean that like you're a failure or, it's not the right fit for you. It's just more of like, maybe sometimes things take time, or there may be needed for some like evolution in what you do. So, and I can attest to that as far as my experiences, that like when I first thought I would go work in academia, like I thought I was going to do something different than what I do now. And so it's like, but I still sought out some opportunities, got some related experiences, and that has kind of helped me towards like where I'm at now. So I try to share that with students. That's like, look, things don't always go to plan.
Right.
That's life. That's nature, and you have to learn to adapt.
Yeah.
And maybe even evolved.
Right. So I guess a great takeaway, it's all about how you handle plan B, C, D, and however many letters come after that, right?
Right. I mean, yeah, plan A might work first, but then there's others that where you might have to go with plan B, C, D, whatever.
Sure. All good. Well, Brian, this has been a great conversation. Thank you for spending some time here on the Electra-Med Edge. Just in case anybody would like to reach out to collaborate, or maybe they have an opportunity or experiential learning opportunity, where can folks find you?
So I'm on LinkedIn. Of course, Valdosta State. I think you're providing my email.
If you're okay with it, I'll put it in the show notes if you're okay.
Yeah. Like contacting me through my Valdosta State email. I also run our Instagram page. My personal Instagram is more like for personal.
Sure.
But I run our Instagram page. That kind of helps promote our program mostly, and it also helps us stay connected with like alumni and whatnot. But our handle is at VSU or EP.
Okay. Well, great. We'll put that in the show notes for everybody as well too. We'll put a link to there. So great. Yeah. Well, Brian, again, thank you so much, sir, for your time. You're sharing your experiences, sharing your insights with everybody, and really wishing you the best and most success here for the rest of this semester, and future success in your future endeavors here as well. So thank you so much. Thanks again for tuning into the Electra-Med Edge, where innovation meets precision in human performance and clinical care. To learn more about Electra-Med's full range of medical equipment and supplies, spanning neurology, cardiology, physical medicine and rehabilitation, sleep diagnostics, and respiratory care, visit us at electramed.com. Also, check us out on LinkedIn and Instagram at simply @Electra-Med. Be sure to follow, subscribe, and share this episode to stay on the cutting edge of healthcare technology. Thanks again for joining us, and we'll see you on the next one.